Hello, friends. Perhaps no one among us would disagree to this. Dr. Ken Berry and Dr. Shawn Baker are the two very best experts on the carnivore diet in the world right now. But did you know? Both these gurus have a totally different methodology, with an entirely different approach towards the carnivore diet, each leading to way different results and health outcomes. And unfortunately, this is where most of us make our first mistake, not knowing which mentor is right for us to follow on this journey. As the advice of the expert we choose for ourselves might not match our prevailing health conditions, and our body might react in a totally counterproductive manner, dashing all our hopes of the wonderful healing benefits on this mighty diet plan. Now, according to the experts themselves, deciding to move on the carnivore diet is one basic thing, while picking the correct mentor and guide is the actual aspect, which makes the ultimate difference in the results and outcome of our carnivore diet. So, to cut out the confusion, after an extensive research spanning over countless number of hours, we bring to you in this exclusive video the 10 shocking differences in the methodology and approach of the two carnivore giants, Dr. Ken Berry and Dr. Shawn Baker, thus enabling us to figure out who really is the most suitable mentor for us to follow on the carnivore journey. We would get to know what is the correct methodology for us to go along and what exact health outcomes we would embrace after spending 30 to 90 days on the right carnivore approach. So, here we go.
Number 1, professional background. Well, friends, Dr. Ken Berry is a family physician with a focus on holistic and preventive medicine, while Dr. Shawn Baker is an orthopedic surgeon with a strong emphasis on athletic performance and physical health. Number 2, core diet philosophy. Dr. Berry promotes the carnivore diet as a solution for metabolic health issues, particularly for those with insulin resistance and autoimmune diseases. Dr. Baker focuses on its benefits for strength, endurance, and overall physical performance. Number 3, food flexibility. Dr. Berry advocates for a more flexible approach to the carnivore diet, allowing some inclusion of dairy and eggs based on individual tolerance. Dr. Baker promotes a stricter meat-only approach, often avoiding dairy and other animal products. Number 4, patient population. Dr. Ken Berry often targets individuals with chronic health issues such as diabetes, obesity, and thyroid problems. Dr. Baker's approach is more geared toward athletes, fitness enthusiasts, and those looking to optimize their physical performance. Number 5, key nutrient focus. Dr. Berry emphasizes the importance of micronutrient-rich organ meats and bone broth as a part of the carnivore diet for healing and overall health. Dr. Baker, on the other hand, prioritizes muscle meats and high-fat intake, focusing more on macronutrient balance for energy and muscle preservation. Number 6, community engagement. Dr. Ken Berry actively engages with a broader audience, including those new to the carnivore diet and those transitioning from keto or low-carb diets. Dr. Baker is more focused on the hardcore carnivore community, often advocating for a zero-carb, strict meat-based lifestyle. Number 7, reliance on clinical evidence. Dr. Berry integrates more clinical studies and scientific evidence in his discussions, aiming to bridge traditional medicine with carnivore principles. Dr. Baker relies heavily on anecdotal evidence and personal experience, emphasizing the results he's observed in himself and others following the carnivore diet. Number 8, medical advice. Well, friends, Dr. Ken Berry provides a more cautious and individualized approach, advising patients to monitor their health markers closely and adjust the diet accordingly. Dr. Baker takes a more aggressive stance, often challenging mainstream dietary guidelines and promoting the carnivore diet as superior for most people. Number 9, mental health. Dr. Berry discusses the potential mental health benefits of the carnivore diet, particularly in relation to reducing anxiety and depression through improved gut health. Dr. Baker focuses more on the mental clarity and cognitive benefits associated with high-protein, high-fat intake. And last on the list, number 10, social media presence. Interestingly, Dr. Ken Berry uses a broad educational approach on social media, providing accessible content for a wide audience. Dr. Baker's content, however, is more direct and often a bit confrontational, challenging critics, and advocating for the carnivore diet in the context of athleticism and peak physical condition. Well, friends, as this was just a quick overview of the major differences in the approach of the top 2 carnivore influencers out there, it is perhaps not sufficient enough to make our final decision which one of these gentlemen is better for you as the ultimate carnivore role model, and whom should you really follow on your own journey. For that, let's cut into some vital details of these key differences, so that we are better able to make the correct decision for our health and wellness goals. Meanwhile, become a proud member of our exclusive carnivore community by subscribing to our channel, helping us spread the carnivore message further. Starting off with the most crucial factor, the professional background. Dr. Ken Berry and Dr. Shawn Baker, while both prominent advocates of the carnivore diet, come from distinct professional backgrounds that significantly influence their approaches to this way of eating. Dr. Ken Berry is a family physician with a strong focus on holistic and preventive medicine. He has spent decades treating patients with various chronic conditions, including diabetes, obesity, and autoimmune disorders. Dr. Berry's medical practice is grounded in the belief that many modern diseases are rooted in poor dietary choices, and that returning to a more ancestral way of eating, such as the carnivore diet, can reverse these conditions. His holistic approach means he considers the body as a whole, taking into account not just physical health, but also mental and emotional well-being. This comprehensive perspective allows him to tailor the carnivore diet to meet the specific needs of individuals, particularly those suffering from chronic health issues. In contrast, Dr. Shawn Baker is an orthopedic surgeon with a background in the military and athletics, including professional rugby and powerlifting. His approach to the carnivore diet is deeply influenced by his experiences in high-performance sports and his understanding of physical health from a musculoskeletal perspective. Dr. Baker has seen firsthand the impact of diet on physical performance, strength, and recovery, both in his athletic career and in his patients. He advocates for the carnivore diet as a means to optimize physical health, particularly for those looking to improve athletic performance, gain muscle mass, and enhance endurance. His focus is less on the holistic aspect of health and more on the tangible, measurable benefits that a meat-based diet can provide in terms of strength, vitality, and overall physical condition. Moving on to the difference in basic diet philosophy of the 2 carnivore giants. Dr. Ken Berry and Dr. Shawn Baker, though both strong proponents of the carnivore diet, approach the philosophy behind this way of eating with different focuses, shaped by their professional backgrounds and patient populations. Dr. Ken Berry views the carnivore diet primarily as a therapeutic intervention for metabolic health issues, particularly those related to insulin resistance, obesity, and autoimmune diseases. His philosophy is rooted in the idea that many modern health problems stem from the consumption of processed foods and excessive carbohydrates, which contribute to chronic inflammation, insulin resistance, and weight gain. Dr. Berry advocates for the carnivore diet as a means to eliminate these problematic foods, allowing the body to heal and return to a state of metabolic health. He emphasizes the diet's ability to reverse conditions like type 2 diabetes, fatty liver disease, and Hashimoto's thyroiditis, often through the elimination of all plant-based foods, which he believes can trigger autoimmune responses in susceptible individuals. As a matter of fact, Dr. Berry's approach is highly individualized, recognizing that each person's metabolic health is different. He often advises his patients to start with a strict carnivore diet, focusing on nutrient-dense foods like beef, lamb, organ meats, and eggs, and then gradually reintroduce other foods to see what their bodies can tolerate. His philosophy is patient-centered, with an emphasis on listening to the body's signals and adjusting the diet accordingly to achieve optimal health outcomes. He often discusses the importance of micronutrients found in organ meats and bone broths, which he believes are crucial for healing and maintaining health. On the other hand, Dr. Shawn Baker's philosophy is centered around the carnivore diet as a means to achieve peak physical performance. Drawing on his background in athletics and orthopedic surgery, Dr. Baker promotes the diet as the ultimate way to build muscle, enhance endurance, and maintain a high level of physical fitness. He views carbohydrates as unnecessary for performance, arguing that a diet based entirely on animal products, particularly red meat, provides all the essential nutrients needed for strength and recovery. Dr. Baker often emphasizes the diet's ability to reduce inflammation and improve recovery times, which are crucial for athletes and anyone engaged in intense physical activity. Actually, Dr. Baker's approach is more uniform and less individualized than Dr. Berry's. He advocates for a strict, meat-only diet, often eschewing even organ meats in favor of muscle meats like steak and ground beef. His focus is on macronutrient balance, particularly the high intake of protein and fat, to fuel the body's energy needs and support muscle growth. Dr. Baker often highlights the simplicity of the carnivore diet, arguing that it eliminates the confusion around food choices and makes it easier for individuals to stick to their dietary goals. His philosophy is grounded in the idea that animal products are the most nutrient-dense and bioavailable foods, making them superior to plant-based options in every aspect of nutrition. By the way, friends, before we move to more critical details, tell us, how has been your experience on the carnivore diet so far? How many health conditions have you healed yet? And which influencer you follow? Do share your opinion in the comments. And now, one of the most critical aspects to compare: the food flexibility. Well, friends, Dr. Ken Berry and Dr. Shawn Baker take different approaches to food flexibility within the carnivore diet, reflecting their distinct philosophies and patient populations. Dr. Ken Berry advocates for a more inclusive and adaptable version of the carnivore diet. He recognizes that individual tolerance to different foods can vary widely, especially among people with chronic health conditions like autoimmune diseases, insulin resistance, or gut issues. Dr. Berry allows for the inclusion of dairy, eggs, and even some low-carbohydrate animal-based products in his version of the carnivore diet, provided they are well tolerated by the individual. Dr. Berry's approach is particularly beneficial for people transitioning from other diets, such as keto or low-carb, as it allows them to gradually eliminate problematic foods while still maintaining a nutrient-dense diet. Dairy products like cheese and cream can offer a rich source of calcium and fat, while eggs provide high-quality protein and essential nutrients like choline and vitamin D. By permitting these foods, Dr. Berry makes the diet more accessible and sustainable for a broader audience, particularly those who may struggle with a strict meat-only approach. His flexibility also helps individuals fine-tune their diet based on how their bodies respond, allowing for adjustments that can lead to better long-term adherence and health outcomes. On the other hand, Dr. Shawn Baker promotes a much stricter version of the carnivore diet, typically excluding dairy and other non-meat animal products. His approach is rooted in the belief that simplicity is key to dietary success, and that the most significant benefits of the carnivore diet come from sticking to a pure, meat-based diet. Dr. Baker often recommends focusing primarily on red meats, particularly beef, lamb, and bison, as they are rich in bioavailable nutrients and provide a favorable ratio of protein to fat. Elaborating a bit, Dr. Baker's strict approach is especially appealing to those who prefer a clear and straightforward dietary plan, without the potential complications that dairy or other animal products might introduce. He argues that by eliminating all but the most nutrient-dense foods, individuals can avoid common dietary pitfalls, such as inflammation or digestive issues, which can sometimes arise from dairy or eggs. This approach, while more rigid, aligns with Dr. Baker's emphasis on peak physical performance, as it minimizes dietary variables and focuses on foods that have been historically associated with strength and vitality. Moving to the key nutritional balance in the carnivore diet. Dr. Ken Berry and Dr. Shawn Baker, both the proponents of the carnivore diet, place emphasis on different nutritional components to achieve their respective health goals. Dr. Ken Berry highlights the importance of micronutrient-rich organ meats and bone broth. Organ meats, particularly liver, are nutrient powerhouses, providing high levels of vitamins A, B12, and D, as well as minerals like iron, zinc, and copper. These nutrients are essential for various bodily functions, including immune support, energy metabolism, and cellular repair. Dr. Berry also advocates for bone broth, which is rich in collagen, gelatin, and amino acids such as glycine and proline. These compounds support gut health, reduce inflammation, and promote joint health, making bone broth a key component in healing and maintaining overall wellness. Dr. Shawn Baker, in contrast, prioritizes muscle meats and high-fat intake, focusing on macronutrient balance for optimal energy and muscle preservation. He advocates for a diet composition where roughly 70% of calories come from fat and 30% from protein. This high-fat intake supports ketosis, a metabolic state in which the body efficiently burns fat for energy, leading to sustained energy levels, mental clarity, and enhanced physical performance. Muscle meats, such as ribeye steak and ground beef, provide all the essential amino acids needed for muscle growth, repair, and maintenance. Dr. Baker's approach emphasizes simplicity and consistency in dietary choices, focusing on foods that provide the necessary macronutrients in the most bioavailable form to support strength, endurance, and overall physical health. This divergence in nutrient focus underscores their respective priorities, with Dr. Berry centering on healing and nutrient density, while Dr. Baker zeroes in on performance and metabolic efficiency. And now the factor that ultimately helps you decide which direction to go, the patient population addressed by the two carnivore gurus. As a matter of fact, Dr. Ken Berry and Dr. Shawn Baker serve different patient populations, which greatly influences their respective approaches to the carnivore diet. Dr. Ken Berry, as a family physician, primarily works with individuals who suffer from chronic health issues such as diabetes, obesity, thyroid disorders, and autoimmune diseases. His approach to the carnivore diet is deeply rooted in addressing these conditions, which are often exacerbated by modern diets high in processed foods and carbohydrates. Dr. Berry's patient population often includes individuals who have struggled with their health for years, if not decades, and who may be taking multiple medications for their conditions. These patients typically come to Dr. Berry after experiencing limited success with conventional dietary recommendations and are seeking a more effective solution. For these individuals, the carnivore diet offers a radical yet effective departure from the standard American diet, allowing for the elimination of inflammatory foods and providing the body with the nutrients it needs to heal. Dr. Berry's approach is patient-centered, meaning that he tailors the diet to meet the specific needs of each individual. He often starts his patients on a strict carnivore diet, which includes nutrient-dense foods like organ meats and bone broth, and then gradually reintroduces other foods to determine what their bodies can tolerate. His goal is to help his patients achieve better blood sugar control, reduce inflammation, and lose weight, all of which can have a profound impact on their overall health and quality of life. In contrast, Dr. Shawn Baker's patient population is more geared towards athletes, fitness enthusiasts, and individuals looking to optimize their physical performance. Dr. Baker, with his background in orthopedic surgery and athletics, focuses on the carnivore diet as a means to enhance strength, endurance, and muscle mass. His patients are often those who are already physically active and are looking to take their performance to the next level. Dr. Baker's approach is less about managing chronic diseases and more about maximizing the body's physical potential. He advocates for a high-protein, high-fat diet centered around red meat to fuel the body's energy needs and support muscle growth. His patient population includes powerlifters, bodybuilders, and endurance athletes who require a diet that supports intense physical activity and rapid recovery. For these individuals, the carnivore diet offers a way to achieve peak physical performance, with benefits that include reduced inflammation, improved recovery times, and enhanced mental clarity. So friends, while both doctors share a common belief in the benefits of the carnivore diet, their differing professional backgrounds lead to varied emphases in their approaches. Dr. Berry's practice is patient-centered, with a focus on healing chronic conditions through dietary changes, whereas Dr. Baker's approach is rooted in optimizing physical performance and strength, often targeting a more athletic audience. This divergence reflects their distinct experiences and the different patient populations they serve, making their contributions to the carnivore diet community complementary but distinct. Moreover, Dr. Berry's patient population consists of individuals with chronic health issues who are seeking to heal through diet, while Dr. Baker's patients are primarily athletes and fitness enthusiasts looking to optimize their physical performance. These differing patient populations shape how each doctor approaches the carnivore diet, with Dr. Berry focusing on therapeutic benefits and Dr. Baker emphasizing physical strength and endurance. In summary, Dr. Berry's flexible approach allows for the inclusion of various animal-based products, making the carnivore diet more accessible and customizable, especially for those with chronic health conditions. Dr. Baker's stricter, meat-only philosophy prioritizes simplicity and the consumption of the most nutrient-dense foods, catering to those who seek clear guidelines and optimal physical performance. These differing perspectives provide carnivore diet followers with options that can be tailored to their individual needs and health goals. So, if you are focusing more on health improvement and reversal of chronic conditions, Dr. Ken Berry might be the right expert for you. And if your objective is more related to physical strength and fitness, Dr. Shawn Baker may provide better guidance in that aspect. We hope that you can now figure out that who is the right mentor for you to follow on your carnivore journey.
By the way, what is your opinion about the carnivore diet? Which expert you find more suitable for yourself? And what health benefits have you gained so far? Do share your journey in the comments. Press the like button if you found this video helpful, and share it with your friends and family as well. Subscribe now to our channel to be a proud member of our vibrant carnivore community, having access to all the vital knowledge you need for your long-term health and wellness. And did you know? There are some historic facts about saturated fat consumption, which you are not aware of. Click the video showing up on the screen to find that out. See you there.